Question 76, which of the following is the most likely diagnosis? Crigler-Najjar, type 1, 2, Gilbert. Okay, so it's a biliary question specifically about conjugation disorders. 20-year-old man presents for evaluation after noticing yellowing of his eyes while studying for finals. He feels well, otherwise he denies abdominal pain, weight loss, changes in urine or stool color, or recent medications. He reports skipping meals and pulling several all-nighters. This guy must be a med student. He had a sore throat and congestion last week. He has no family history of liver disease. Physical exam is normal, and then they give us a bunch of labs. So right away, there's a couple of really important things here. This seems to be happening with stress. He's skipped meals, he's pulling all-nighters, but he feels well otherwise. It's not like a multi-system process. He also was sick last week. Maybe he's still sick. The other thing I want to point out is that there's no changes in his urine or stool color. Changes in urine or stool color are common if you can't get bilirubin into the stool. The stool becomes lighter, more clay color. The urine becomes darker as it accumulates more bilirubin. So that should help us eliminate anything that would prevent bilirubin from being excreted into the GI tract. Let's go ahead and take a look at the labs now just to verify what we're thinking so far. So total bilirubin is up and direct bilirubin is low. Then we have just a ton of labs here. AST, ALT, ALP, all within normal limits. Hemoglobin appears to be within normal limits. Retics are probably fine. Haptoglobin's normal. LDH is normal. So Crigler-Najjar type 1 and 2. Type 1 is the super severe version that usually results in death in infancy. Type 2 is slightly less severe, but they both tend to present earlier on in childhood and tend to have much, much higher bilirubin. Think 20 or higher. This is a problem with conjugation, though, which is also what we're seeing here. If we don't have a lot of direct or conjugated bilirubin, then the problem is in fact conjugation. But Crigler-Najjar is out just because this would have presented much earlier in life and probably would have higher bilirubin anyways. Gilbert syndrome is very common. This is also a conjugation problem, but tends to happen more sporadically. Think stressors will bring it on. So things like recent upper respiratory tract infections, or staying up late to study, or skipping meals can all point to Gilbert. So this one's looking pretty good. Let's just check the others. Autoimmune hemolytic anemia. No way, not with all the information they gave us. The version you're seeing probably only has haptoglobin or LDH. LDH is normally within red blood cells. So if red blood cells are being lysed, LDH is spilling out and it would be high. We don't have that, so it's probably not hemolytic anemia. That's just a good rule of thumb. Anytime you see high LDH, you should be thinking possibly hemolysis. Not always, but possibly. And then when red blood cells spill out their contents, they spill out their hemoglobin, and that's bound up by haptoglobin. So haptoglobin would be low, while LDH would be high. So this one is definitely out. Dubin-Johnson is one of those syndromes, kind of like Crigler-Najjar, that affects bilirubin. The difference, though, what makes Dubin-Johnson special is that Dubin-Johnson has conjugated bilirubin. It's not a problem of conjugating. It's a problem of getting rid of the conjugated bilirubin. So that's when you would expect to see your urine or stool color changes. So one way that you can remember that Dubin-Johnson results in conjugated hyperbilirubinemia as opposed to the others, which would result in unconjugated hyperbilirubinemia, is that Dubin-Johnson do be conjugating. There you go. I'm somewhat of a genius myself. So that leaves us with the correct answer of Gilbert. It's very common, very commonly tested as well. Think episodic bouts of scleral icterus, or even just an incidental finding on routine blood work. But it would pop up with stressors like viral infections or staying up late, skipping meals.